The emergency room does testing to look for evidence of a heart attack and other physical problems, but he's found to be quite healthy. He has not been using any drugs, and his caffeine use is only 1 Coke a day. Caffeine is kind of important. I had a person who was drinking a case of Mountain Dew a day and came in for treatment for anxiety, and I instead of saying that it was this disorder, which is a possibility, of course, in that case, I said, let's try to get rid of some of the caffeine and maybe that would help. And sure enough, she did. That's what happened. So, but anyway, so the emergency room doctor sent our gentleman here home, but he referred him to a psychiatrist. And of course, the person, this guy says to himself, or says to the doctor, you know, he's kind of offended actually. How dare you suggest I see a psychiatrist? And this guy says, I'm not crazy. Why would I need a shrink? Classic, okay? It's classic stuff, and this is why I'm doing these talks, by the way, so that all of us know that this isn't being crazy. This isn't craziness. It's a brain illness. So unfortunately, though, you know, he doesn't follow advice, and unfortunately, these episodes continue. And despite his avoidance of going into stores, now he starts to have them when he's driving. He's had 1 or 2 when he started to drive, and he's starting to avoid driving. He's lost his job. He's had to move back in with his parents, and finally, the parents say, "Look, you know, I don't care if we think you're crazy or not. You're going to see a psychiatrist." So they drag him into the psychiatrist. Okay, now let's talk a little bit about panic disorder, and then at the end of this part, I'll tell you what happens with this guy. First of all, any questions about this case? Anything that I left out that you guys want to know about? Okay. What is panic disorder? Now, we talked about a panic attack, so you guys remember that, right? The 4 or more symptoms and the fear, the intense fear. Panic disorder is when you have these unexpected things, these unexpected panic attacks. There's no hungry lion. You can't figure out what it is. There's something that's causing it, but you're not sure what. What it is, probably anyway, is this part of the brain that causes this fight or flight reflex. It's starting to fire or discharge when it shouldn't. Okay, why that happens, we're not sure, but I suppose like anything else. I mean, we were talking about seizures earlier. Some people have other electrical activity in their brain that just kicks off and it causes a seizure. Maybe this part of the brain just sort of kicks off, not like a seizure, but it's sort of like that, and kicks off when it shouldn't. And that may be what happens. So you get these unexpected panic attacks, and they have to occur repeatedly. So they occur over and over again, followed by at least a month of where you become afraid of having them, because they're scary, right? I mean, we talked about it. It may feel like a heart attack or something. It's pretty scary stuff. So you start to become afraid of having one, and what we call that is fear of fear. It's kind of funny sounding, but it is. It's a fear of having a fear reaction or a panic attack. So when you have that stuff, when you have the panic attacks that are unexpected, for at least a month you get afraid of having another one, and it interferes with your function. That's kind of a key one, right? If you're just having them and they're not that bad, and you still can work and you can still drive and do all the things you want to do, maybe you don't need medicine or big time treatment or anything. You probably, it may get worse though, so you may want to see somebody anyway. But unless it interferes with function, and that's kind of the way it is with a lot of psychiatric diagnoses, is that they have to interfere with your function in some way, or we're not as concerned about it. Again, these things, they shouldn't necessarily always have some type of trigger. So if it's only around snakes or it's only around something like that, then it's probably not panic disorder. If it's only the effect of Mountain Dew or caffeine or cocaine or something like that, then it's probably not a panic attack. If it's only the result of some physical problem, like high thyroid, let's say, if your thyroid's way out of whack, there's other symptoms of that too, but it's one of the things it can do is cause a lot of anxiety. And it also,
Would high blood pressure also cause panic?
A panic disorder or a panic attack? Typically not, but I will say that if sometimes when you've had panic attacks, you've had several of them, you kind of get used to the physical symptoms that occur when you have them. And then if you, let's say, most people can't feel their blood pressure, okay? But let's say your blood pressure did get high enough where your heart felt like it's called palpitations, where your heart feels like it's beating out of your chest. If you were to get that, or if you were to get really fast heart rate, and you knew that you had those every time you had a panic attack, a lot of times what happens is people start to ruminate, oh my gosh, it's going to happen again. I just know it. Last time I had this, I had a panic attack. So it's a psychological thing, and you throw yourself back into it. But typically, just an increase in blood pressure shouldn't cause panic disorder for sure. And I'm hard pressed to figure out how by itself it would cause a panic attack. But good question. Good question. Now, as you can imagine, people start to avoid things. They start, like this guy, our example we used. A lot of people do end up locked up in the home. They won't go out of their house. I've even had patients who wouldn't come out of their bedroom in their house because they came out and they came out in the living room, started having panic attacks, became fearful of coming into the living room, so they stayed in the room. That's not so good. Imagine how that would feel, okay? So 50 to 65% of people with panic disorder also have depression, okay? Because now you're not in control of your life anymore. And I don't remember if I mentioned this when we talked about depression, but that's a key thing for depression. It's a really high risk thing. I mean, if you don't feel like you're in control in your environment, whether that's at home or at work or whatever, overall, I suppose, if you don't feel in control of your environment, it's a high risk factor for depression. So a lot of these folks, 50 to 65%, will end up with depression, major depression. The good news is the treatment actually can help both, so that's the good news. About a third to a half of folks with panic disorder will also have agoraphobia. Has anybody heard of that? Agoraphobia? It's a fancy word, but basically means a fear, a sort of fear of getting into a crowded public place where getting out is either difficult and hard to do, or embarrassing. Okay, so the classic one I always ask people about, the way I always say it, I always ask people, can you go to Walmart? If they say, heck no, I'm never going to Walmart again. I was in there and I got trapped and I couldn't get out. I mean, that's agoraphobia. If you can go to Walmart, you're probably you don't have agoraphobia problem. I hope I didn't. Hope this is going to be shown on TV, so hopefully Walmart's not going to sue me or something for mentioning it. It's just a crowded. It could be Kmart, it could be any others too. But any place that's crowded and a lot of people and it's hard to get out of. Incidentally, a lot of these folks end up with substance abuse problems. Why would that be? Because in our society, seeing a shrink you thought it was crazy, right? But taking a nip of alcohol, that's socially acceptable, right? That's an okay thing to do. The problem is that you start to drink because you're afraid of having one of these things, and you pretty much stay intoxicated a lot. That can sort of cause its own problems, as cause dependence on alcohol. So another one is folks can sometimes get addicted to other usually it's downers. It's not people that have panic disorder. They don't want to be sped up, so they don't take cocaine or stimulants or methamphetamine or anything like that. They usually end up being hooked on something that treats them or that brings them down. So alcohol's one. Sedatives like Valium, Xanax, those things are the others. These things, panic disorder can kick in adolescence, and then there's also another sort of peak in life, and that's in the mid-30s when it kicks in. And it's kind of chronic, so it's not something that usually, even with treatment, if you get in treatment and you do pretty well, and then you stop treatment, and they've looked at 6 to 10 years later, how do these folks do? 30% are well, so 30% are doing pretty well, but 40 to 50% are improved but still having symptoms, and a whole 20 to 30% are worse, the same or worse than they were with the original symptoms. So that's kind of tough. Now, in my experience in the psychotherapy part of it, if you can do that and learn a lot of these we'll talk about this in a second, what we do with these things, but if you can learn some of these mental tricks, those are things you always take with you, right? I mean, those are things you're going to remember, hopefully, and be able to use from then on. Whereas medicine may be something you don't maybe want to stay on medicine the rest of your life. So a lot of people won't stay on it. So they'll take their medicine for a year or so, they'll get better, a lot better. But if they don't do any psychotherapy and they stop the medicine, I think that's probably the people that get worse. Let's talk about this case here for a second, and then we'll talk about treatment and how we treat this panic disorder. So let's go back to this is our 20-year-old guy. He gets drugged into the psychiatrist by his parents. And he tells the psychiatrist he's having about 3 to 4 panic attacks a day. This is fairly classic. I mean, this is kind of a normal, what I would see in practice. He is diagnosed with panic disorder. The psychiatrist explains the disorder and tries to normalize the symptoms that he's experiencing, and this helps a little bit. In other words, he goes through this whole thing I talked to you guys about, explaining why do you have these symptoms, why do you feel this way.